On average, people in Europe are becoming healthier and healthier. But this average hides very big gaps. Even in the same town or city, poorer people or those with less education may live 5 or more years less than those who are richer. And between the regions of Europe, the gaps are even bigger. This map shows life expectancy for men for EU regions. The gap in life expectancy between these regions is between 6 and 18 years.
Inequalities in health do not arise primarily because of inequalities in the healthcare system. The inequalities in health arise because of the conditions in which people are born, grow, live, work and age.
This conclusion is borne out by the experience of Estonia, where for some sections of the population, poor living conditions and unemployment contribute to behavior that damages people's health.
The main problems in people's health were mostly alcoholism, reckless driving, and nowadays, again, when a lot of people are getting unemployed, probably the incidence of suicides.
There are still also parts of Europe where many houses don't have mains water or their own toilet. In such conditions, it's not surprising that health is worse. There's a difference in life expectancy in the different neighborhoods of London. Research shows that life expectancy goes down by 1 year for every underground station you stop at from Westminster to Canning Town. So what can be done? Many European countries are taking concerted action on the causes of health inequalities. But what about the European level? The European Commission has set an ambitious agenda to tackle the health inequalities within Europe and to raise solidarity in health.
We have to start now. Closing it in a generation implies let's start with today's girls who are going to become women, who are going to become mothers, and boys who are going to become fathers.
I am very, very concerned that there are so much inequalities amongst various social groups in Europe, various ethnic groups in Europe, and also various people with different incomes. Poor people should not suffer poor health. Bridging health inequalities requires joint action by many players, many stakeholders. I am confident that by working together, we will ensure that all European citizens will have better health and will live a longer, healthier life.
Honorable Minister, colleagues in public health, distinguished delegates, ladies and gentlemen. Though I cannot participate in person in the discussions over the next 2 days, I am deeply honored to share some of my thoughts with you in this short address. Let me start by congratulating the Belgian presidency carrying on from Spain. I am impressed with the work and commitment of your presidency to tackle the complex problem of reducing health inequities. This event that is organized today and tomorrow in Flanders, looking at the role of the regions in addressing social determinants of health and related health inequities, is very important for WHO. Health inequities are increasing in many of the 53 member states of the WHO European region, and in a fast-changing Europe, health inequities pose challenges not only to ministries of health, but to governments nationally, regionally, and locally. Can we perform better in promoting health in Europe? Can we reduce health inequities by leveling up the health status of the weakest segments of our population, and by doing this adding value to the social, economic, and human development of our countries regions, and cities. I firmly believe that we can. Your conference is important because you have decided to look very pragmatically at the role of the regions and at what works and what does not work in tackling the social determinants of health inequities. Ladies and gentlemen, on the occasion of your conference, I would like to extend to the regions of Europe the same commitment I made to our 53 member states at our regional committee meeting in September, just a few weeks ago. That was the first regional committee since I took up my post of regional director. As regional director, I will do my utmost to strengthen the WHO Regional Office for Europe, to support national and subnational efforts to promote health and tackle health inequities. Subnational levels of governance are increasingly important for health policy. Furthermore, the strengthening of health systems at subnational level is a priority in our countries, given the present trends in decentralization and devolution. Reducing health inequities is important for the European region as a whole and is central to my agenda. At the regional committee meeting, the member states endorsed the key components of my vision for the way forward, a new health policy for Europe. The new European health policy, Health 2020, will be developed through a participatory process involving member states and other partners, including the European Union and its institutions. The objective is to ensure an evidence-based and coherent policy framework that will address the present and forecast the future challenges to population health. This policy will be informed and underpinned by evidence, among other things, by a European review of social determinants and health divide, which I commissioned and which will be chaired by Professor Sir Michael Marmot, who will address you later today. I have also made a clear commitment to renew, revitalize, enlarge, and strengthen the WHO Regions for Health network. This work will be coordinated by the WHO European Office for Investment for Health and Development, based in Venice, Italy. I am pleased with the progress of this regional network since I took office. The potential is great and the gain is huge. I am pleased that the network has already taken a crucial step forward with the choice of focusing on the social determinants of health for the next 5 years. We should plan a major event in 2011 to relaunch the network with a strong program focusing on the social determinants of health, aimed at increasing the capacity of European regions in this domain. I call upon the Regions for Health network to be engaged, consulted, and support the new WHO European Health Policy that we aim to present to our 53 member states in 2011 and 2012. Ladies and gentlemen, health is a key and unique resource for today and tomorrow's Europe. It is a resource that must be nurtured. It is a resource that will help Europe to be more united and stronger in dealing with our present economic difficulties. I am pleased that, linked to the Belgian European Union presidency, today's conference is engaging so many regions in our common efforts to promote health and reduce health inequities in our European family. I wish you all a great conference and hope that the Regions for Health Network General Assembly that follows the conference will be a real turning point for our network. Thank you very much for your attention.
Dear colleagues, ladies and gentlemen, inequalities remain too high in the European Union. It's true from state to state, but also inside every member state. Let's talk about Belgium. Thanks to our social security, every Belgian can have access to a good quality of care. However, a recent study of our Public Health Institute pointed out that important health inequalities still exist in Belgium. First type of health inequality, the link between education and prevalence. Obesity is twice more frequent in the less educated population. It is mainly due to the bad nutrition. Logically, diabetes is also 3 times more frequent in the same group. Second type of health inequality, the link between education and prevention. Control of glycemia, of cholesterol, is much better among the highly educated population. This is not logical when you consider the occurrence of obesity and diabetes. Third type of health inequalities, the link between education and health consumption. Let's talk about dental health. 65% of less educated people do not brush their teeth enough. And 65% of the same group does not go to the dentist regularly. However, a visit to the dentist is free for every child under 18. In Belgium, federal and regional health authorities are working hand in hand. This study is a good example of what we can do together in a complementary way. The result of this common study will help us to improve the access to our health system together. This conference will focus on the contribution of the regions. And the regional level is in closer contact with the people. That is an important asset to fight against inequalities. I wish you a very successful conference.